I am asked frequently by patients how I am able to do a tummy tuck procedure and not use a drain when so many other surgeons use drains. The answer is that for the past 20 years I've used what is called progressive tension sutures in order to close the space under the skin that normally might accumulate fluid. This is normal fluid that the body produces in response to the surgical procedure that is being performed. The next question would be, well, how reliable are these progressive tension sutures and how well do they prevent fluid accumulation? This is called seroma in our medical lingo. I did a study a number of years ago that was published last year, 2021, in which I looked at the last 440 cases or so, 300 of which were abdominoplasty, and that's tummy tuck surgery, to analyze whether or not fluid accumulated in any of these patients. In fact, of the over 300 patients that had tummy tuck procedures, there were no instances of fluid accumulation, in other words, no seromas, in that group of patients. And none of these patients had drains. I have adapted a technique for progressive tension sutures that in addition to closing the space so that fluid doesn't accumulate, the sutures can be used to actually improve the aesthetics. And I particularly use this in tummy tuck surgery in order to accentuate the normal anatomical separations, if you will, in the overall contour of the abdomen, so that that nice midline valley that you see in a toned abdomen, and those parallel valleys toward the outer part of the abdomen are created and accentuated, so that after the surgical procedure, instead of this sort of uniformly flat abdomen that has no real depth, three-dimensional character, I can create that three-dimensional character and improve the aesthetic so that it looks more natural and it doesn't look like a tummy tuck. And I strive very hard, and I spend actually a little extra time in placement of those sutures in order to create that look. So I think it enhances both the recovery of patients so they don't have to have a drain, and it also enhances the aesthetics of the procedure. Thank you so much. If you have any other questions, please forward them to us and I'd be happy to answer them. Thank you.